So please help me welcoming Dr. Christophe Bayer, Head of the Division for Health Security and International Crisis Management from the Federal Ministry of Health on stage. Dr. Bayer, welcome. Would you briefly introduce yourself to the audience?
Welcome.
Einmal drücken.
Yes. Okay, now it's working. So thanks a lot for this invitation. It's really an honor being here and kicking off with you this Future Lab. And I'm pretty sure it will not at all be boring or something like this. It will be a fantastic experience to work on these really exciting scenarios which you have prepared. So my name is Christophe Bayer. I'm head of the Division for Health Security and International Crisis Management. And it's also right now a while since I'm working at the Federal Ministry of Health, but I've not always worked at the Ministry of Health. From my background, I'm a medical doctor and a lawyer. I'm specialized in epidemiology, and sometimes, long times ago, before I became a bureaucrat, I was working in hospitals, spent some time with WHO and UNICEF, including in Africa, for example, in Goma, in the DRC region, in Uganda, was working at the Robert Koch Institute, doing my specialization in epidemiology, and now since a couple of years working on policy aspects mainly, and including the Ebola outbreak 14 to 16, COVID-19 crisis, and so on, various G7 and G20 fora. So that's in a very brief nutshell, my background.
Thank you very much. Many of you were here, I think, last year, where we had a debate on stage about opportunities and challenges of the shifts that are currently happening in the global health ecosystem. And I think many agreed that there's also an opportunity in that disruption, because also power can shift, responsibility can shift. Now we are in a situation where calls for German leadership are growing louder, and sometimes it feels like we have forgotten the discussion of last year. So therefore, I would like to ask you, what does leadership actually mean to you in this context?
It's really not an easy question. So I would define leadership as something like really taking on a reliable and responsible role to force shaping outcomes. So that's what's all count. It's definitely not about bringing German norms and standards to somebody else, and it's definitely not about money, what we are seeing here right now. And so as said, it's about strengthening global public health by taking on responsibilities, and taking on responsibilities, again, it's not one by one with investing and providing funding. So, and there's so much more what we can provide here from Germany, and that's what we are doing, and trying to define our leadership role in that manner. And that manner includes as well linking as well the global health aspect to the national and regional health aspects. Because it's quite important that we convince as well our population that there is this important link between national health and global health. We are living in a time where we, as you have seen in the media during the last days, the population is facing cuts in the social system. And then the question is more and more obvious: why are we spending, or why are this request for additional spending, or even hold up our spending for international and global health, while at the same time we are facing dramatic budget cuts nationally as well. So therefore, it's quite important so that we all make the case why global health matters for national health at the same time. And let me come to the multilateral system. The multilateral system, this is, I think there we are really in a leadership role again, by bringing in our expertise and trying to be, and very often being successful, a bridge builder. For example, when it comes to the negotiation on the amendments of the international health regulations, that's where we've been quite successfully, of course, along with others, but as well for the pandemic agreement. And now I will be honest, we are struggling hard when it comes to the negotiations of the pathogen access and benefit sharing system, which is part of the pandemic agreement. But at least we are trying to come up and build bridges here. And this is part of being in a leadership role, in a responsible leadership role.
Mm-hmm. I'm hearing responsibility, bridge building, financing not only, but also. And you mentioned the multilateral system and PUBs already. So why do we particularly need more leadership in the area of health security?
So it's since a long time that security, the issue of security, attracts really politicians. And health security, it's a fundamental issue for our population and for the population globally. And health security has undergone dramatic changes. It has undergone dramatic changes in two ways. First, the landscape of actors and the way actors are acting has changed dramatically. Of course, you all know what I'm alluding to. It's the US. The US has really shaped the landscape of health security during the last decades. They have shaped it as well in a very positive manner, including, for example, when it comes to IHR capacities. Now we have a very sometimes negative perception, but as well there have been quite a number of positive aspects. Nevertheless, the US, they are no longer part of the WHO, and therefore there is a gap, there is a vacuum as well. And this gap and vacuum will be filled, including with knowledge. So, but the second aspect is that the landscape when it comes to the threats and hazards we are facing has changed as well a lot. We have not only pandemics and natural disasters with perhaps with epidemics which are happening in the aftermath, but we are facing as well more and more complex crises, including armed conflicts. We are facing threats of non-state actors and state actors, as well when it comes to potential biological and deliberate biological events. And last but not least, there is a threat we can't even oversee right now. At the same time, it's an opportunity. It's artificial intelligence. What can you do with artificial intelligence? And I'm quite happy that one of the scenarios you all will work on is on artificial intelligence and cybersecurity.
Yes, thank you for pointing that out already. Many of those challenges will be discussed in the subgroups in just a few minutes. And you also already mentioned non-state actors in the room. So why do you need the non-state actors here in this room for this exercise today?
From my opinion, it goes without saying. When underlining the complexities of all the issues, this goes potentially far beyond of what a state actor alone can manage. We need really a whole of government, but as well a whole of society approach to tackle all these threats and challenges. And whole of society includes as well the non-state actors. And of course, it's the responsibility of non-state actors as well to bring in their expertise, and it's the responsibility of us, or being a part of a state actor, to as well tap into these resources. And therefore, I'm quite happy that we are doing this today. And it goes without saying, and you all know it better, you have so many different kinds of expertise you are bringing together here. When it comes, let's say, operational management in the field, lab support, field epidemiology, but as well think tank work, shaping policies, helping governments to shape policies, but at the same time sometimes to challenge governments on kind of policies, and as well when it comes to artificial intelligence and a number of other aspects, including international lawmaking. It's all knowledge the non-state actors can bring in and should bring in.
Thank you. Thank you. I hear a little invitation also for challenges and for being challenging also, and pointing out where to go. And we're all looking forward to your contributions. So we don't want to do this exercise, obviously, to stay here in this room. So what will happen with the recommendations that the people here in the room will develop today?
Yeah. So what we are intending and what you have seen in the agenda is that there will be Future Lab Parts 2 and Future Lab Parts 3. And these further parts, they will be as well used to discuss and take up the recommendations, the solutions, the ideas, and potentially the gaps you have identified during the scenarios. So there will be a member of parliament as well giving her perspective, and other key actors from the international field will as well take up your recommendations, bring in their perspectives, and then it's up to us. It's a Federal Ministry of Health. Of course, we are we are the leading ministry when it comes to the global health strategy of Germany, then it's up to us as well to use your recommendations for an interministerial assessment and to see which of these recommendations or tasks you might have given belongs to which ministry. And I have to say as well, in particular when talking about threat scenarios and looking to the national aspects, it's as well about the different levels. We have a very federal system here in Germany, as you all know, and also we have to take into consideration the role of the local and of the regional health authorities here in Germany. Yeah, and that's what we endeavor.
Wonderful. Thank you so much. I think I speak for most of the people here in the room, and I thank you for your openness. Thank you for listening, and I'm looking forward to a productive session. And with that...
Yeah, likewise. Looking forward to a very productive session, and thanks again for bringing up all these scenarios. They're really excellent. Looking forward to it. Thanks so much.
Thank you.